ice and heat. No one ever knows how to use it right, even though it's a common thing to do. It's a very important thing when we're talking to employees on site. My name is Dr. Brad Conder. I'm the owner of On-Site Focused Physical Therapy, and today I want to talk about some of our common advice that we kind of give employees as far as ice and heat. We like to use these kind of gel ice packs. I mean, there's a lot of different ways we can do ice on site. You can do the popping one-use ice packs. Oftentimes, I suggest that employers try to make like ice stations. These ice packs, I can get them on Amazon for 20 bucks. You can get yourself a kind of a standalone freezer, even have it available for people at the break room or places they can take breaks. And also like a sign out is something that we oftentimes kind of try to promote to people, is have a sign in and out of your ice packs so you don't lose them and we can use them for everybody. Okay, so one of the first things I tell people, or the questions that they give me, is like, should I use ice or heat? Well, you know, in general, ice is a natural anti-inflammatory. It's what a lot of people don't remember, is that, okay, we have an acute problem, whether it be an injury or like some things that come on to you, you don't know what's going on, whether your back pain, knee pain, whatever it might be. Ice is a natural anti-inflammatory. It actually goes a couple inches deep too as far as the tissue, so it can really help manage the pain, also help manage swelling and inflammation. And also, a lot of people truly don't want medication, to be honest. We know that a lot of times if they go to a doctor group or like a ER, one of the only things they can do is medication, and a lot of people don't want that. So I tell them, it's like, if that's the case, a lot of times we're going to give you anti-inflammatories anyway. Ice packs are a great way to kind of help that. 10 minutes all you kind of need, two to three times a day. Making sure to also have like the ice pack wrapped in something so you don't burn them, and that way we can help them with that. Now when it comes to heat, heat can be fine. Oftentimes I tell people heat actually is not going to hurt a lot of conditions, but oftentimes it may not help it. So my advice for heat is make sure not to burn yourself. You can do an ice heat kind of regimen where you do ice and then maybe 30 minutes later do heat. You can kind of mix that up. It's not a bad way to do that. I've even had some people do ice and heat at the same time. So if they need ice for the low back but they hate ice, put ice there, maybe a heat pack up their shoulder so they don't get too frozen. So that's your advice on ice and heat. Hopefully this helps out. We can give advice to your employees. Like I said, you're going to have to repeat this 1,000 times to your employees. I don't care how many times I've talked to employees about how to handle this. They always forget. They always need more advice, which is fine. That's what we're here for. So when we do our early intervention programs, when we're on site, we can help the employees learn how to do self-care, especially with simple things like ice and heat. So hopefully this helped out. If you have more questions or like to know more about some clinical things we can do for employees on site, email me at brad@onsitept.com or call me at 502-509-3136. I'd like to hear more from you. Stay safe, and I'll talk to you soon.